Imagine feeling fear, even when nothing is wrong. Your heart races, your hands shake, your mind won't stop. This is anxiety, and millions of people live with it every day. But what if I told you there are powerful medicines that can calm this storm? In this video, you'll discover the main drugs used to treat anxiety, which ones doctors prefer first, and the real pros and cons you must know. Anxiety isn't just one condition. It comes in different forms. Some people have generalized anxiety, where worry lasts for weeks without any clear reason. Others struggle with social anxiety, where even simple interactions feel overwhelming. Panic disorder causes sudden attacks with sweating, tremors, and a racing heart. OCD brings unwanted thoughts and repetitive behaviors, like constant hand washing. Then there are specific phobias and PTSD, where past trauma keeps triggering fear. So what's happening inside the brain? The answer lies in chemicals. When your brain has too much norepinephrine, your body stays in fight or flight mode. When GABA, the calming chemical, is low, your brain becomes overactive. And serotonin, the mood stabilizer, plays a huge role in keeping anxiety under control. That's where anxiolytic drugs come in. The most important group and the first choice doctors use are antidepressants called SSRIs and SNRIs. Even though they're designed for depression, they're actually the best long-term treatment for anxiety. They work by increasing serotonin levels in the brain. But here's the catch, they don't work instantly. It takes about 2 to 3 weeks to feel the full effect. The good news? They're safe, non-addictive, and well-tolerated. Next are benzodiazepines, fast-acting drugs that calm anxiety within minutes. Sounds perfect, right? Not exactly. While they work quickly, they can cause drowsiness, memory problems, and even dependence if used for too long. That's why doctors only use them short-term or during severe anxiety attacks. Then comes buspirone, a lesser-known but very useful drug. It works slowly, like antidepressants, but doesn't cause sedation or addiction. It's ideal for long-term anxiety control. However, it's not helpful if you need immediate relief. There's also an older group called barbiturates. These drugs are rarely used today because they can be dangerous. They cause strong sedation, breathing problems, and even overdose risk. So, they've mostly been replaced by safer options. But that's not all. Some other drugs can also help. Antiepileptics like pregabalin can reduce anxiety symptoms. Certain antipsychotics are used in difficult cases. Beta blockers like propranolol help control physical symptoms like a racing heart and shaking, especially in social anxiety. And antihistamines like hydroxyzine can provide mild calming effects. So what's the bottom line? For long-term anxiety, SSRIs and SNRIs are the best and safest first choice. For quick relief, benzodiazepines work fast, but should only be used short-term. Buspirone is great for chronic anxiety without addiction risk. And other drugs are used depending on the situation. Anxiety can feel overwhelming, but with the right treatment, it can be controlled.